Hi, my name is Jessica, and I am going to be performing a heart and lung assessment on a patient. I have already gathered my supplies. I'm going to enter the room, introduce myself to the patient, identify them, and wash my hands.
Come in.
Hi, my name is Jessica. I'm going to be your nurse today. How are you doing?
Fine, thank you.
Can you tell me your first and last name?
Debbie Morris,
And your birthday?
11/21/1956.
Okay. If my patient was in the hospital, I would look at their ID band to ensure that they are telling me the correct name and the date of birth to make sure that they don't have dementia or any other problems like that. I'm now going to wash my hands to provide safety for both you and me. Washing my hands. While I'm doing this, I'm going to be looking at her respirations without telling her, so that way I can ensure that she doesn't change them as I am listening to or watching her and counting them. I'm going to be looking at the depth that she breathes and how much her lungs expand to make sure she's getting full volume, she's not breathing too shallow, and she's not breathing too deep. I'm also looking at her chest size. It looks very symmetrical. It doesn't look like one side is bigger than the other. It's not concave or contoured anywhere. I'm now going to feel to make sure that it all feels symmetrical. And as I'm doing this, I'm feeling the position of her ribs, and I am also listening or feeling for any tactile fremitus, which would be snap, crackle, or pops underneath the skin. It feels good and in position. I'm now going to listen to her lungs. All right, deep breath for me. Again. 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 Okay. Take this right hand up, put it over your head. Deep breath for me. Beautiful. Okay. Can you turn for me?
Which way?
Just turn, yeah. There you go. Turn all the way if you can, like where your feet are over there. Perfect. Alright, breathe for me. Again. Again. One last time. Okay, turn back around. So while I'm doing that, I'm listening for any adventitious breath sounds. Her lungs are clear, both posterior, laterally, and anterior, so that's a good thing. I'm now going to listen to her bronchial sounds. Those sound good. Now I'm going to listen to her heart. I'm going to listen to her aortic, pulmonic, Erb's point, mitral valve, and tricuspid valve and mitral valve. And I'm going to listen to them with both the diaphragm and the bell of the stethoscope. That's listening to make sure that they have no murmurs. Aortic, pulmonic, Erb's, tricuspid, and mitral. I'm going to flip my stethoscope. I'm going to go back and listen the other way. Aortic, pulmonic, Erb's, tricuspid, and mitral. I heard S1, S2 sounds. I didn't hear any S3 and S4. I did not hear any murmurs. While I'm looking at her, she does not have any jugular vein distension, which is a good thing. I'm now going to feel her carotids. I'm going to not feel them both. I'm not going to feel them both at the same time, because if I do that, that could cut off circulation to her head. That feels good. I do not feel any thrills. no drills on that side, and now I'm going to listen to see if they have any bruises. I'm going to listen with this side of my stethoscope. I did not hear any bruises, so that is a good thing. Now I'm going to feel her pulses on her arms. Feel her brachials. They are +2. I'm going to feel her radial pulses. They are +2. That's a good thing. I'm going to take her socks off now. And pull her pants up. So I'm going to feel her posterior tibial pulse first. It's good and strong. It's +2. +2. And I would be feeling these both at the same time just to ensure that they both feel the same. I'm going to follow the line between her big toe and her second toe up a little bit, and that's where I'll find her pedal pulse. It's there and it's strong. In a normal situation, I would be wearing gloves. I do not have any gloves here at home. I'm looking at her legs. She has no edema. They are not shiny. She does have some hair on them, so that's a good sign that she has good circulation in her legs. There's no pitting edema at all. It's nice and good. Now I'm going to go on and ask about her breast exams. I'm looking at her breasts, and they're about the same size and the same shape. They are very symmetrical to each other. Putting my head off. They don't concave or anything like that. Do you do monthly breast exams at home?
Yes.
Okay. Do you care if I teach you how tell you how to do one to make sure you're doing it correctly?
No, that's fine.
Okay. So when you're doing a breast exam at home, you want to start out before you get in the shower. When you have no clothes on, you're going to look in the mirror, make sure that your breasts are symmetrical, and the nipple line is within the same line. This is with your hands down. You're going to put your hands above your head and ensure that they are still the same way. And then once you get into the shower, you're going to put whatever hand of the breast you plan on examining up in the air, and then you're going to take your opposite hand and start in your armpit and work down. While you're doing this, you're going to be using the pads of your fingertips to ensure that you're able to feel any bumps or lumps or divots in your breast. Once you get out of the armpit, you're going to work in a circular motion around the nipple. If you feel any changes in your breast, you need to make sure you notify your provider as soon as possible so you can get a mammogram. You need to do this on both sides simultaneously. Can you repeat back what I said to you so I can ensure that you know what you're doing?
Yes, ma'am. To do a breast exam, I need to do like out of the shower in front of a mirror, make sure they're both approximately the same size, that the nipples are like the same line, symmetry. When I'm in the shower, if I'm going to do my right breast first, I'm going to raise my right arm over my head, use my left starting at that armpit and moving down with the pads of my fingers in a circular motion around to the nipple, noticing if there's any lumps and discharges or changes.
Yes.
And then I do the opposite one, and if I find any problem, notify my doctor.
Yes, ma'am. Perfect. Have you ever noticed any rashes or any discharges around your nipples or on your breast?
No, ma'am.
That's a great sign. Okay. So, thank you for allowing me to take care of you today. It's been a pleasure to work with you, and if you have any questions, please feel free to reach out to us, okay?
Yes, ma'am. Thank you.
You're welcome. And I would perform hand hygiene before leaving.